Welcome to Medent Tutorials. In today's presentation, we shall continue from where we stopped. So we are talking about the tunics or the layers of the cardiovascular system, but we shall place more emphasis on the vascular system. So at the end of today's presentation, you should know the types of blood vessels, the tunics or the layers of the blood vessels, differences between the tunics of arteries and veins. You also need to know the types of capillaries and the functions of endothelial cells. So without wasting my time, let's begin. So the vascular system, also called the circulatory system, is made up of the vessels that carry blood throughout the body, delivering oxygen and nutrients to the body tissues and taking away waste product. These vessels include arteries, veins, and capillaries. Arteries transport blood away from the heart. Veins return blood back to the heart. Capillaries surround body cells and tissues to deliver and absorb oxygen, nutrients, and other substances. Capillaries also connect the branches of arteries to the branches of veins. Now the walls of blood vessels. Like we said earlier on, all part of the cardiovascular system is made up of 3 layers. So the walls of the blood vessels also have 3 layers. These layers include the tunica intima, tunica media, and tunica externa, or inner layer, middle layer, and external layer. These layers surround the lumen, that's the hollow interior through which blood flows. So let's go through it one after the other. So the tunica intima, like I said earlier on, this is the innermost layer of the vessel. It consists of the inner endothelial cells, followed by basal membrane or lamina, and then the subendothelial connective tissue and the internal elastic membrane or lamina. So these make up the tunica intima. So this is for both vessels, that is artery, veins, and even the capillaries. So the next part or layer is the tunica media. This consists of smooth muscles. The thickness of the smooth muscles would depend on the type of vessel we are talking about. So in elastic vessels like the aorta or greater arteries, it is predominantly elastic fibers. And then in muscular type, it is predominantly smooth muscles, which means that the tunica media is made up of smooth muscles and elastic fibers depending on the type of vessel we are talking about. Of course, both will be present, but again, depending on the exact vessel, then we'll have either it is in abundance of elastic fibers or smooth muscles, and that is elastic arteries and muscular arteries. So apart from this, we have the external elastic membrane, which is quite different from the elastic fibers. Don't forget, in the tunica intima, we say we have the internal elastic membrane, and so we must also have what? The external elastic membrane. These make up the tunica media. Now the tunica external, or the outermost layer. This is also known as the adventitial layer or tunica adventitia. It has layers of connective tissues. Now the thickness of this tissue depends on the type of vessel. So in arteries, this layer is actually very thin, whilst in veins, this layer is very thick. Now this layer consists of a lot of collagens and fibroblasts. It also has vasa vasorum. This is because this layer is kind of far from the tunica intima, where blood supply is rich. So this layer actually gets blood supply through the vasa vasorum. So you can find this over there. Inside the connective tissue, or inside the adventitial layer, we also have nerves and lymphatics. Nerves and lymphatics. So these are also the layers of, or the component of, the tunica externa. So now the differences between the artery and veins. Arteries and veins. So in terms of the lumen, arteries have a narrow, or a narrower, or arteries have a narrow lumen than the veins. So in veins, the lumen is wide. So the thickness in artery, it is thicker, whilst in vein it is thinner. Talking about the thickness of the tunics, the tunica media is thicker in artery. In vein, the tunica externa is thicker. In veins, or in terms of elastic membranes, of course, it is more in the arteries than in the veins. And in terms of the connective tissues in the adventitia, it is less in arteries and more in the veins. Now, one thing I didn't mention is that arteries do not have valves, but veins do have valves. Blood flow from or away from the heart in artery, and blood flows towards the heart in veins. Blood in artery carry oxygenated blood, of course, except for pulmonary arteries. Whilst in veins, they carry deoxygenated blood, except for pulmonary veins. So these are our differences between the arteries and veins. Now let's move to the capillaries, which are a little bit different from the arteries and the veins. Now the capillaries are tiny blood vessels, usually between 5 to 10 micrometers in diameter, that transport blood, nutrients, and oxygen to cells in organs and body systems. Capillaries are composed of only the tunica intima, just the tunica intima, consisting of a thin wall of simple squamous endothelial cells with basal lamina. So in capillaries, we do not have tunica media and tunica adventitia, and that's very unique, and that's also because of its functions, or the role it plays in the body. So let's move to the types of capillaries. Types of capillaries. We have the continuous, the fenestrated, and sinusoidal capillaries. Sinusoidal capillaries. So in continuous capillaries, the endothelial cells are held tightly together by tight junctions, also known as the zonular occludings. So tight junctions. Then the basal lamina is continuous. Now it has a lot of pinocytic vesicles for transcellular transportation of substances. That is, movement of substances from the apical to the basal area of the endothelial cells. Now these can be found in the central nervous system, skeletal muscles, exocrine glands, and so on. Now, fenestrated capillaries. Fenestrated. The word fenestrated means there are what? Pores. Pores. So this means that there's a presence of pores in the endothelial cells. Again, basal lamina is also continuous, but this is not a continuous capillary, but rather a fenestrated capillary because of the presence of pores. It has few or no pinocytic vesicles present. Transport of substances is usually paracellularly. Paracellularly, that is between the tight junctions or in between the pores. It has a diaphragm. Now, this type of fenestrated capillaries can be found in the kidney, in the GIT, in the endocrine, in the pancreas, and so on and so forth. Now, the sinusoidal capillaries. They are also called discontinuous capillaries. Discontinuous capillaries. The endothelial cells are loosely connected to each other. The basal lamina is discontinuous. So in these capillaries, they do not have pinocytic vesicles and diaphragm. They are commonly found in the liver, the spleen, the bone marrow, lymph nodes, adrenal cortex, and so on and so forth. Now the functions of endothelial cells. 1. Endothelial cells are very useful for vasoconstriction and vasodilatation, and hence it helps in the control of blood pressure. They help in the release of von Willebrand factors for coagulation. They actively signal to the white blood cells of the immune system during inflammation. They contain and express substances that prevent clotting, including heparan sulfate, which acts as a cofactor for activating antithrombin. They also have what we call the nitric oxide, which inhibits platelet aggregation. They also release prostacyclin, which also inhibits platelet activation. Platelet activation. So now, permeability of capillaries. So how do substances pass through capillaries? 1. By simple diffusion. It can be by active diffusion, by fenestrations, by interendothelial gaps or by pinocytic vesicles. Pinocytic vesicles. So these are the ways through which substances move through the capillaries. So, in summary, there are different types of blood vessels. We can talk about the arteries, the veins, and the capillaries. In the arteries, we can talk about muscular type of artery. We can talk about the elastic type of artery, and so on. And we also have the veins. So in veins too, we can talk about the muscular type of vein. The muscular type of vein. Alright. So we said the tunics or the layers of the blood vessels, there are three. We have the intima, we have the media, and we have the adventitia. And depending on the type of vessel we have, you can tell about which layer will be thick, which layer will be thin. And of course, we spoke about the capillaries and the different types of capillary that you need to know: the continuous, the fenestrated, and the sinusoidals. Then we spoke about the functions of the endothelial cells. So I believe you have learned one or two things from this presentation. So if you enjoyed this, just follow us on our social media handles, and if you are watching this on YouTube, kindly subscribe for more.